How do cholinesterase inhibitors interact with dopamine in Parkinson's disease? Parkinson's disease is a complex condition that affects both movement and cognitive function. One interesting aspect is how cholinesterase inhibitors interact with dopamine in this context. Cholinesterase inhibitors, or such as, are primarily used to treat cognitive changes in Parkinson's disease. They work by preventing the breakdown of acetylcholine, a neurotransmitter that plays a key role in memory and attention. Dopamine is another important neurotransmitter, especially for motor control. In Parkinson's disease, there is a significant loss of dopamine-producing neurons, particularly in a brain area called the substantia nigra. This loss leads to the characteristic motor symptoms of Parkinson's disease, such as tremors and stiffness. While dopamine replacement therapies, like levodopa, are essential for managing these motor symptoms, cognitive impairment is also a major concern. Acetylcholine and dopamine have a unique relationship in the brain. They interact in a brain region known as the basal ganglia, which is crucial for regulating both motor and cognitive functions. While dopamine primarily controls movement, acetylcholine helps modulate dopamine releases and its effects. This means that when cholinesterase inhibitors increase acetylcholine levels, they can indirectly influence dopamine pathways. Cholinesterase inhibitors, such as rivastigmine, are mainly used to manage cognitive symptoms in conditions like Parkinson's disease dementia and dementia with Lewy bodies. Research has shown that these medications can improve cognitive function and even help with neuropsychiatric symptoms, such as delusions and hallucinations. However, it is important to note that they do not directly address motor symptoms and should not replace dopamine replacement therapies for those issues. In summary, while cholinesterase inhibitors do not directly interact with dopamine in a way that would replace dopamine therapies for motor symptoms, they enhance cognitive functions and may have an indirect effect on dopamine pathways through their action on acetylcholine. This makes them a valuable addition for managing cognitive and neuropsychiatric symptoms in Parkinson's disease. If you or someone you know is considering cholinesterase inhibitors, it is always best to consult with a healthcare professional for personalized advice.